The Social Security increase for 2026 has been finally announced. Your check is going up. The question is by how much? Let's review the headlines together. This is from the Social Security website. It says Social Security announces a 2.8% benefit increase for 2026. And this is USA Today. Social Security COLA is 2.8%, but seniors will still fall into poverty. I want to explain the challenges that seniors are facing with this disappointing cost of living adjustment and what it means for you and what you can do about it. And this is from CNBC. Social Security Administration announces 2026 COLA benefit increase of 2.8%. What does it mean for you? That is what I want to talk about. What does this number mean for you? What is the size of your monthly increase if you're on Social Security or disability benefits? Let's talk about it. My name is Kwame Kwade. I am a government benefits expert. For 15 years, I've been helping seniors get the retirement benefits they deserve. I create content on Social Security, Medicare, Medicaid, food stamps, and other personal finance topics that affect seniors and their retirement. If you're new here, welcome. I am glad you're here. Do me a quick favor, go into the comments and let me know your city and your state, because I like to know where you guys are watching this broadcast from. And if you've been watching my channel for a while, welcome back. We have a lot to cover. This is news we've been waiting for since October the 15th, when COLA was supposed to be announced. But because of the government shutdown, we didn't get that information, and it was finally released a few hours ago. So let's dive into it. So the first thing I want to talk about is the fact that this lines up with the estimate that I've been sharing with you over the last couple of weeks. I told you the Senior Citizens League predicted that it was going to be 2.7%, and Mary Johnson, the Social Security policy analyst that is widely respected, was predicting a 2.8, and I had shared that I thought it was going to be 2.8. Why? Because I thought the inflation report was going to come higher than everybody predicted, and that's exactly what happened. The inflation report came in today, and it was the final piece of the puzzle that the Social Security Administration needed to finish calculating the COLA report. But inflation came in at 3%, which was higher than, it's the highest it's been since January. So it made sense that cost of living adjustment will trend towards the higher part of the prediction. So the question is, what does this mean for you? Well, the Social Security Administration has put together a whole list of what this breaks down for you on a monthly basis. And it's called the Social Security 2026 changes. And so let's walk through that. I'm going to give you details, but it goes on to break it down by section on what you are going to get and what this means for you. So I'm going to review all of that in a second. But first, let's compare how this Social Security cost of living adjustment for 2026, stacks up against previous cost of living adjustment. So to do that, I am going to go back to the Social Security Administration website and share with you some of the previous Social Security data. They have a whole page that highlights cost of living adjustment since the 1970s. So here is the page, and you can see it starts from 1975 and goes all the way to 2026. So here is what you need to pay attention to. You can see over the last 10 years, 2015 was 0% increase, 2016 was 0.3, and then you look at 2020 before the pandemic, 1.3% that January, and then you go to 2021, 5.9. The highest the last 10 years was 2022, 8.7, and then it started going down to 3.2, 2.5 this year, and then now is going to be 2.8. It's been announced in 2025 and is going to go into effect in 2026. So what does this mean for you? Well, let's dig deeper into it. Now, before I get any further, I wanted to share with you the number you saw on the screen, 443-293-0080. That is our text club. If you want to receive breaking news like today, we just sent a text message to thousands of seniors who are on our text list receiving breaking news updates about Social Security and other benefits, anything that will affect your retirement. We want to be the first to bring it to you. So sign up for this and join our text list. Text the word insider to 443-293-0080 and you'll be added to our list. The service is free and you are going to be getting breaking news messages and other important messages that we think you should know or be aware of. So that is the number you see on the screen. Now let's talk about what this Social Security cost of living adjustment means for you. How much increase are you going to get? And what are the other changes that are happening as a result of this? I am going to share with you 7 major changes that are happening to Social Security in 2026 that's going to affect everyone. Let's dig in. The first one is the most obvious. How much is your benefits going to go up? For Social Security, I'm comparing 2025 and 2026. As you can see, Social Security, the average benefit is going to go up by $56, and that is rising from 2015 to 2071. If you're a couple receiving Social Security, both of you, you're getting an $88 total increase. Your benefits are going to go from $3,120 to $3,208. If you're on Social Security Disability Insurance, SSDI, you are getting a $44 increase from $1,586 to $1,630. That's the average benefit. If you're on SSI, your maximum benefit is going up by $27 from $967 to $994. And if you're on SSI as a couple, both of you are receiving benefits, you are going to get an increase of $41 from $1,451 to $1,491. So the headline news here is that if you're on Social Security retirement benefit, your average benefit is going to go up by $56 starting January the 1st, 2026. And if you're on disability SSDI, you're getting a $44 increase. And if you're on SSI, you're getting a $27 increase. Let me know in the comments what you think about these average increases for 2026 based on what you know about inflation. If you've been watching my channel, I've been talking about inflation the entire last couple of weeks and sharing with you detailed information about prices that are going up across the country and in specific areas like housing, transportation, food, electricity, etc. So based on what you are experiencing, the real inflation you are experiencing, regardless of what the government is saying, what do you think about this average increase for 2026 for both Social Security and disability? Let me know your thoughts in the comment section below. We've been waiting all year for this. So now that it's here, I want to hear from you. Let me know what you think in the comments. The second number that's going up is the maximum Social Security benefit. If you paid the maximum amount into Social Security and you're retiring in 2026, you are going to get $4,152 a month, up from $4,018. Remember, this is the maximum benefit at full retirement age. So not everybody gets this, but it does go up every year like everything else. Now, the maximum taxable earnings is going up. This is very important. It means that if you are still working and paying into Social Security, this is the limit on how much you will be paying in Social Security taxes. How much income is subject to Social Security taxes. That also goes up every year based on cost of living adjustment. So 2025 it was $176,100. 2026 is going to be $184,500. If you're on disability benefits, this is an important screen to pay attention to. There is something called disability thresholds, and it is what the Social Security Administration uses to determine whether you are, disabled enough to continue to work or not. And so if you have been approved to start working on a part-time basis, this screen provides important data that you need to pay attention to. If you are non-blind, you cannot make more than $1,690 in 2026 if you're working and on disability. Otherwise, you could threaten your disability benefit. If you're blind, it's $2,830. If you're in the trial work period, your monthly threshold is $1,210. You go over that amount, and you may be running into some serious issues with your benefits. There are Medicare updates that I want to share with you here, and let's get through it because there's a ton of them. The first thing I want to share is that your Medicare Part B premium is going to go up to $206, up from $185. And your maximum out-of-pocket cost for Medicare Advantage is going to decrease from $9,350 to $9,250. That's probably the only good news I'm seeing. But let's talk about Medicare in general. There's a lot of confusion around the schedule, so let's review it. Currently, we are in the Medicare open enrollment, also known as the AEP. This provides the most flexible plan during the year. It allows beneficiaries to make changes to their Medicare Advantage plan or their Medicare Part D prescription plan. You can also switch from original Medicare to Medicare Advantage or vice versa. Or you can sign up for Medicare Part D prescription drug if you haven't done so already. This period that we are in runs from October 15th to December 7th. Here is the deal. There are three major changes that are happening to Medicare that you need to pay attention to and consider. And at the top, it should say 2026. But anyway, there are three things that you need to consider during this open enrollment in order to, before you make any decision about Medicare and what you sign up for. The first one is that Medicare Advantage plans are going through tremendous changes. They're going through three separate changes. Number one, Medicare Advantage plans are getting changes in specific states where plans are leaving states or severely limiting which parts of the states they provide benefits. So your current Medicare Advantage plan, you should not just automatically renew that. You should make sure that the plan is still even available in your state. Number two, Medicare Advantage plans are paring back benefits. Some benefits that were considered free, like grocery card or rights to setting medical appointments, etc., have now all been pared back or taken away. And then the plans themselves are changing dramatically. So do not assume that the benefits that were available to you in your Medicare Advantage plan will still be available in 2026. The third change that is happening with Medicare Advantage is hospitals are leaving specific plans. So if you are in a particular area and you need access to a specific hospital, make sure that that hospital still accepts the Medicare Advantage plan that you're in. So that's the first change that is happening with Medicare. The second is prescription drugs. Prescription drug plans are changing, and you want to make sure that the medication that you need, number one, is covered by your plan, but number two, is affordable to you. So make sure that you review that carefully. And then the third biggest change that is happening with Medicare has to do with original Medicare. A lot of seniors thought original Medicare was better than Medicare Advantage. Well, that may not be the case anymore because there's going to be a big change happening to Medicare, original Medicare, that is going to make it look similar to Medicare Advantage. And in 6 specific states, Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington State, starting January 2026, you are going to need pre-authorization in order to get certain services, procedures, or devices if you are on original Medicare in those states. It's going to be a pilot project that's going to run for 5 years. And believe me when I say this, they are just trying to run it to get some data so that they can use that to then roll it out to the entire country. So I'm saying all that to say, do not blindly renew your Medicare Advantage plan. Do not blindly renew your original Medicare plan. Go onto the Medicare website and compare plans and prices. But if you want free advice that is unbiased and that will get you, to a plan that serves you well and covers not only your budget, but covers the provider network you need to be in and the prescription drug that you need covered, call our partner, Chapter Medicare, at 539-205-2147. These guys are not there to sell you anything. They're there to be in your corner and help you figure all of this out, compare plans in your area, and switch to a better plan for you that meets your budget and your needs. And we've sent over 3,000 of our viewers to chapter. And if you've been watching my channel, you know I've been talking about peace of mind about Medicare. That is where this starts. Number one, reviewing your current plan and making sure that it still serves you. And if it doesn't, being able to know all the options available to you so that you can switch to a better plan. That is what chapter can do for you. Give them a call. And because it's open enrollment season, they're busy. And so if you rather have them call you, if you call them and you probably get a wait, then you can fill out the form that I'm going to include in the comments and in the description. Fill out that form and they'll reach out to you. But my point is that you should call chapter and let them help you figure this out, because there's so many changes happening and you don't want to be left behind. So that is about Medicare. And as I share with you, there's a lot of changes that are happening that you need to pay attention to. So I'm going to go back to my slide and continue to share with you the changes that are happening with Medicare. Based on the Social Security announcement, the changes that are happening that you should pay attention to. We were talking about Medicare, and I am going to pull back my screen and share more with you. So the point is that from now until December the 7th, we are in the first Medicare enrollment period. And then from January 1st to March 31st, we're going to enter another open enrollment period where even if you're enrolled in a Medicare Advantage plan, you can switch plans, so that's another opportunity for you to be able to switch from Medicare Advantage to Medicare Original or Original to Medicare Advantage. So it's a second opportunity to get it right. So make sure that you get it right the first time, but you have another opportunity at January 1st if you make a mistake or you change your mind and you want to switch to a different plan. Now, the sixth change that's happening next year is about working while you're on Medicare, on Social Security. If you're currently not at your full retirement age and you are working, you need to make sure that you understand what the 2026 earnings test is. In 2026, you can make up to $24,480 and still not get anything deducted from your Social Security check. That is $2,040 a month if you are working on Social Security under your full retirement age. If you go over this limit, for every $2 you go over the limit, you lose $1. That is for 2026. Now, if next year, if 2026 is the year of your full retirement age, you can work up to $65,160 and not get anything deducted from your check, your Social Security check. But if you go over this limit, for every $3 you go over the limit, you lose $1. And then when you reach your full retirement age, the month you reach your full retirement age, you can work as much as you want from then on, and you would not lose anything from your Social Security check. But remember, there are still Social Security taxes. And so that may be something you have to think about if you're working and earning this kind of money. Finally, the seventh change that is happening is that the full retirement age for Social Security is moving permanently to age 67 for anybody born 1960 and later. This has been a long time coming. As you can see, it's been creeping up slowly. It moved from 55 to 67, but it was permanently set at 66 for anybody born between 1943 and 1954. And then they started adding 2 months over the last 5 years. And finally, we've reached the full retirement age of 67. And now they are talking about increasing it again to age 70 to save Social Security. But that's a whole different conversation we can have another time. So if you are a senior and you are looking at this and you're saying, well, $56 does not do a lot for me, I am going to do a whole video this in the next coming days talking about strategies for seniors and how you can maximize your Social Security, resources that are available that you can tap into so that you can stretch your Social Security benefits, but other programs that you may not know about that are available to you so that you can continue to, maintain a decent living, based on the fact that the COLA, the cost of living adjustment, has not lived up to expectation, and we all can agree on that. But there's help out there. There's resources I'm going to share with you that is going to help you navigate the next couple of months, and even the next year, better equipped. So if you like what you heard, hit the like button, hit the subscribe button, and I'm looking forward to seeing you on another video tomorrow.